Hello viewers, welcome to Ayurmegha Health World. Nowadays we see many are suffering from a very common problem, that is cervical spondylosis. To discuss in detail, we have with us Dr. Nidhi Navani, an Ayurvedic doctor. Let's get in the video and let's talk to her. Ma'am, what is cervical spondylosis?
Now, cervical spondylosis is something which many of us are suffering from because again it's a lifestyle disorder. The way we treat our body, especially the neck portion, the way we are treating it, that is, and most of us slowly, that is how we are developing cervical spondylosis. Now what you ask is, what is cervical spondylosis exactly? So a very scientific term will be, that suppose these are our vertebrae. Okay, we have vertebrae in a cervical. So between these vertebrae there is a jelly like thing which is known as disc. Now because of our odd postures or a sudden jerk or a sudden fall or accident, whatever reason, there are chances at times, or our working style, there are chances that there is a compression between these vertebrae.
Okay.
Once this compression comes, now this is a jelly like thing, okay, it just squeezes out. It squeezes out, it bulges out, and it starts going and starts pinching at the spinal cord and even at the nerves which are starting from there supplying to different parts of the body. So that is how cervical spondylosis starts, and that is what basically cervical spondylitis or cervical spondylosis is. So it is a compression of vertebrae which leads to disc bulge, and as a result that disc bulge causes pain in the neck, radiating to hands. At times there is numbness associated with it, stiffness in the shoulders, stiffness in the neck. Patient is unable to move neck to fully, like this, they are not able to do this. There is a continuous pain in the neck. At times heaviness in the head. All these symptoms, group of symptoms I would say, they constitute cervical spondylosis.
Yes, ma'am. Many complain that while they are walking they feel like current shock situation and all. So they always complain that we have disc pain, disc herniation, disc bulge. So what is the difference between these three?
They are basically, disc bulge is when it is just bulging to a little amount, that is just a bulge. When they say disc herniation, herniation means it is a next stage, little more than bulge. So it is just herniating and pressing at that particular nerve which is supplying, either to the hand or, to the thoracic chamber. So that is meant by herniation, a stage next to disc bulge.
And what is the root cause of this, ma'am?
Now coming to root cause, as I mentioned, it's a lifestyle disorder. So let us start, where are we going wrong? Now most of the people, we are working in ITs, even if not in ITs, we are almost, working in systems or laptops. Now you see how you sit. Whenever you are using a laptop, whenever you are using a system, you are continuously, keeping it here at a level which is, below your eye level, and you are bending your neck and then working on it. That is one thing. The second biggest problem is the mobile. Now people are like this, even small kids, they are like this with their mobile. Now understand, with every degree I bend, I am adding weight to this neck muscles, and neck muscles are not so strong because we are not doing that kind of hard physical work which our parents used to do. So the neck muscles are not that strong to hold the vertebra in place. As a result of these postures, we get compression. So main cause is the postures, the kind of postures, So it can be continuously working in front of the system with the bending neck. Mobile, second thing, we are over the phone like this many a times, we keep it like this and then we continue to work. Many females in the kitchen, they continue to do the cooking like this and talking like this. Okay, then lying down and watching television like this. Okay, now you just see, these are all odd postures and how much pressure you are adding to your neck muscles. How will it sustain? Definitely, at one point of time, these muscles will collapse, and as a result, this vertebrae, they will compress.
Okay. Many go for physiotherapy if they are suffering from this kind of pain. Is it good to go for physiotherapy, ma'am?
Yes, in the initial stages where people have muscle spasm, definitely physiotherapy helps. But in the later stages where they are having disc bulge, or it has reached to a point where disc herniation is happening and there is a pressure on the nerve or on the spinal cord, their physiotherapy might not be effective. And physiotherapy also has different levels, grade 1 or grade advanced level, basic level. So with basic physiotherapy, this problem will not be going. There has to be a decompressing technique coming into it, where we do the decompression of these vertebrae, and that's how we get good result.
What are the symptoms of this spondylosis?
Symptoms, as I mentioned, you know, they're starting from mild neck pain or severe neck pain, stiffness in the shoulders, radiating pain to the hands, tingling sensation in the hands. These are all the symptoms. Even heaviness in the head, at times reeling sensation or giddiness if it's a severe cervical spondylosis. So these are the symptoms.
How do we diagnose this, ma'am?
Okay, for a confirmatory diagnosis, first these are the symptoms. For confirmatory diagnosis, either we can go for an X-ray, CT scan or MRI of the spine, cervical spine.
Ma'am, what are the treatments available in Ayurveda to treat this spondylosis?
Yes, we have again wonderful Panchakarma treatments, wherein we see that, you know, the muscles are becoming strong. See, whatever treatment we do, it should not be just limited to some time frame that the patient comes to us, we do the treatment and patient feels good. Definitely for some time if I do treatment, patient will be good. But here we see that, you know, it's a sustainable treatment. We work on the muscles also of the patient so that the muscles, they become strong enough to carry that vertebrae. Then we guide the patient, okay, that these are the things they have to do, these are the postures they have to follow, these are the exercise what they have to follow, this is the particular diet what they have to follow, and that is how we are able to give them a very effective treatment in Ayurveda for all the cervical spondylosis problems.
So what lifestyle they has to maintain?
You need to take care, you know, you have to use your body consciously, that is the only answer. Okay, whenever you are driving, make sure, you know, no random driving. It has to be a very smooth and safe driving. Please give respect to all the gutters, humps, speed breakers. Okay, no rash driving at all. Second thing, whenever you're working on your systems or your laptop, please see that, you know, now you get those tables are easily available, right? So see that, you know, they are at your eye level. You're not going to bend it down every time. Don't be on your mobile like this at all. If you you have to use your mobile, keep it like this and then use the mobile. Every now and then, if you are having continuous job, if you are sitting for hours together, every 1 or 2 hours, please, you know, get up from your seat or at least take a break, move your neck to the sides, rest for 5 minutes, again get back to work, give it a break. Okay, so that is, then as I mentioned, don't lie down and watch television, don't lift heavy weights, okay, don't use the mobile like this and then continue with your work. So all these are odd postures. The more consciously use your body will be more effective. Simple.
Will any types of exercises or stretches will be helpful for this spondylosis, ma'am?
Yes. So, see, now if the patient has already developed spondylitis, if it is a severe condition, then immediately these stretches or exercises are not, yes, even yoga are not that effective. Once the patient comes off that, you know, the critical thing, that the severity, if that decreases, later on to see that it's a sustainable thing and the patient is not developing the problem again and again, there is no reoccurrence, then definitely all these neck exercises, stretches and yoga, it is very, very much helpful.
Thank you.